The 1A, 1B, on Monday, you can start to schedule appointments. Pharmacies will start coming online some Monday, more on Wednesday. We'll start opening the providers. We're going to have thousands of providers coming online next week. Monday basically is when the registration website will open to make an appointment. We're talking about 4 million people, right? And even though there are thousands of centers, you don't want to have 4 million people descending on any center, and we want to do it by reservation. So on Monday, we will open up a website that will tell you, here are the pharmacies in your area, here are the doctor networks in your area, here's the mass distribution site in your area, call your Walgreens on Main Street and make an appointment. That's on Monday for 1A, 1B. To the extent, hold that second point. The Walgreens, the distribution sites that are open, they need to first prioritize their own healthcare workers, because we don't want a COVID-positive pharmacist. We don't want a COVID-positive nurse who then does 50 vaccines in a day and then infects 50 people, right? So they will be doing their healthcare workers first. But on Monday, 1A, 1B will basically be able to make a reservation. Some doctors' networks and pharmacists and mass vaccination sites may say, come in Wednesday, come in Thursday, come in Friday. It depends. Hospitals, we still want to continue prioritizing the healthcare workers. The healthcare workers are far from done. And I am deluged with calls from healthcare workers saying their hospital hasn't made the vaccine available. So I'm asking the hospitals, if I had the power, I would order them to stay open 7 days a week, 24 hours a day. I'll tell you the truth. But the hospitals have to continue to focus on the healthcare workers. On Monday, 1A and 1B will be open for the entire network, primarily by appointments. Hospitals can open 1A, 1B, but prioritize healthcare workers. Because, as I said, this is all about keeping the hospitals open. And I'm tired of people talking about we honor our frontline heroes, the nurses and the doctors. That's nice. Rhetoric is nice. Cards are nice. They want vaccines. And you want them vaccinated, because you don't want to go before a nurse to get a vaccine who's COVID positive. And you don't want to see a hospital closed down because they can't get nurses because the nurses are sick, especially in this situation. So hospitals are part of the network. They prioritize healthcare workers, but they can also do 1B. Pharmacies are part of the network. They're going to be ultimately 5,000 pharmacies, but we want them to do their healthcare workers first, so they're not spreading the infection. Doctors' offices, same thing. Do your nurses, do your doctors first. And community-based centers, same thing. Vaccinate your healthcare workers so you're not spreading. As I said ad nauseum, the universe of 1A, 1B is 4 million people. At 300,000 dosages per week, that takes 14 weeks. Calibrate that, please, because that means a police union doesn't get enough vaccination for 14 weeks. A teacher's school district does not get enough vaccination for 14 weeks. 75-year-olds will not be able to get a vaccine up to 14 weeks. And the disconnect is going to be, the governor said, Monday I could call for a reservation. Yes, but it's going to be 14 weeks, which is an incredible amount of time. I use my mother as an example. I'm telling you the conversation I'm going to have with my mother. She's going to say, I called for an appointment, and they said they don't have an opening for 3 months. And she's not going to be happy with me. And I'm going to say, yeah, but I told you that. And the conversation will go downhill from there. Please calibrate that. We are dependent on the supply. I work closely with the Biden administration. They are working on accelerating the supply. That is great news. And the more we get, the more we transfer. And the more we transfer, then the faster that would be. So if we go from 300 to 400, it goes from 14 weeks to 10 weeks, or whatever the math is. But it's pure math as far as we're concerned. And as fast as the feds can regulate it, the better. I want to double down on the caution that the providers must follow the rules. You cannot show favoritism one group to the other. And you can't give the vaccine to people who are not eligible for the vaccine. I don't care if the person thinks they're a big shot. I don't care if it's a mayor. I don't care if it's a county executive. I don't care if it's a bank president. People are people, and lives are lives. And nobody's life is more important than anyone else's life. And this rationing system, this prioritization was accepted federally, nationally, by governors all across the state. It makes sense. It's fair. But we have to do what's fair. And don't commit fraud with the vaccine. And don't give it to your friends. And don't give it to your family who's not eligible. Follow the law. And it is the law. And if you don't follow the law, we're going to enforce the law.